Everyone here definitely knows someone who has gone through a mental disorder or is currently having a mental issue. The mental issue I'm going to be speaking about today is depersonalization and derealization. One out of 3 people currently have depersonalization. That means one of us here are going through it. Over 200,000 people in the United States have symptoms of depersonalization daily. I've done extensive research on this topic over the years and also have encountered it in every of my psychology class as a psychology major. Depersonalization is very common, but it is rare and difficult to make out or recognize. Now you definitely want to know what that is. According to the American Psychological Association in 2013, depersonalization is unreality or detachment from or unfamiliarity with one's whole self or from aspects of oneself. Dr. B. Hunter from British Journal of Psychiatry also made a case study in 2008 with 204 people and found out that the average youngest age that someone will start having this disorder is 16, and the highest average age is age 40. Little kids and older people hardly have this mental disorder. This mental disorder, depersonalization, is a dissociative disorder. So you will feel yourself dissociating from your body, arguing who you are, not realizing what your reality is, and now you would probably also, feel dead inside or feel like you're living in someone else's body. Watching yourself from inside or outside is definitely what we're going to see here. Now you see that you no longer feel part of the world, you feel disconnected, time is moving past you and you're not doing what you should do at the time. We can also see someone here doubting, looking at his body from the inside and thinking that he is remotely or robotically controlling himself. These type would look at their hands and not feel that they are theirs. They would think that their whole body is someone else's and they're inside controlling it. They would doubt everything around them. Now that you know what depersonalization is, the cause is that we know, according to psychology and research, we don't have a particular cause or know a particular cause or the cause of depersonalization. Here, you can see that these are the type of experiences where they have no emotions, things seem unreal, and they have out-of-body experience. This is also the graph showing us dissociation, depersonalization over different countries and cultures, according to Cambridge University Press. Depersonalization, because it has no cause, this is one of the things that makes it hard to figure out or identify it. It has complications and disruptions of cause. You would not want to go and be part of life and do what everyone is doing. You can also disrupt your family life, work life, and school life. These risk factors can worsen depersonalization. Number 1 is drug use. Number 2 is personality disorder. Depression and anxiety that also go on for a long period of time can definitely move into or graduate into depersonalization or derealization. Depersonalization can also come and leave. If you have symptoms for about 3 days and you no longer get them, you might not want to see a doctor. But when to see a doctor is definitely when you've had this for over a long period of time. One of the permanent cure of depersonalization is psychotherapy. And this is talk therapy, where you speak to someone about your feelings and then they can give you medication on that. In the end, now you know what this is. You can go around and look and see or spot out people who have similar experiences or symptoms as you've seen and let them know to seek professional help. Do not go around diagnosing people with this particular disorder. And out of 3 of us here, I've been struggling with depersonalization or derealization. over the years, but it's slowly leaving. Thank you.
Perfect.